Well, hello everyone, and welcome to another of our COVID-19 community updates here at the City of Brandon. Today, once again, we'll have myself and our emergency manager, Mr. Brian Kays, and again, for context, we're recording this on Monday, August 31st at 4 p.m. So sadly, we continue to see new cases in Prairie Mountain Health and in Brandon in particular on a steady basis. The average over the last 7 days in Brandon is 11 new cases per day. Most are still linked to known contacts or clusters, but they do indicate that some are not explainable, meaning the possibility of some community transmission. Even more concerning is that a few cases are recently linked to 3 of Brandon's personal care homes and to one of the floors at Assiniboine Centre at the hospital. So those are certainly concerning situations. Once again, they declare that the risk is low, but they're taking the most strict precautions, and certainly our thoughts are with all of those people that are associated with those facilities and the limitation that it may put on visitations and the like. So for all of us, we still have some work to do. I believe our community's response for the most part has been superb. However, given these ongoing cases, I don't want our citizens to get frustrated and give up on all of the personal efforts we are all making. Naturally, we all have the human tendency to want to see some rewards for our efforts and inconvenience. With COVID, that may take some time. We have no choice but to stay the course and bear down and keep practicing all the fundamentals: physical distancing, hand sanitizing, mask wearing everywhere we go. I don't like it any more than any of you do, and believe me, as mayor of this fabulous city, I certainly don't like seeing our community having to endure these spikes in COVID cases. But that said, I view it that cases or no cases, these new safety procedures we all must follow, I expect will be with us for quite some time, perhaps until most of us are vaccinated, which will be many, many months ahead. So I look at it, no point in whining about it. I accept the hand sanitizing, the physical distancing, and mask wearing as just part of my daily routine, and I just go about my business otherwise largely unchanged. If we all do this, we all stick to the precautions, we'll keep ourselves, our family and friends, and our community safe and healthy. Keep in mind, September long weekend is this coming weekend. While we all want to gather for the last summer long weekend, now is the time to avoid gatherings, keep your bubble small, and focus on the fundamentals. If we do that, we'll all be making our personal contribution to flattening this curve in our region and in our city. So now I'll turn it over to Mr. Brian Kays for some updates from his desk.
Thank you, Your Worship. Roller coaster ride, Groundhog Day, a dripping water faucet, a merry-go-round, your sister's endless storytelling, wash your hands, practice physical distancing, wear a mask, stay home if you're ill. Is there any other way to describe what we're going through? Brandon and Westman, it's time for some of us to get with the program. Stand up and take responsibility for your community. We already know that some of us won't take responsibility for ourselves. If you're sick, stay home. Self-isolate. Stay away from everyone else. No matter how sad and lonely you feel, get over it. If you're sick, stay home. We don't want to see you, no matter how popular you think you are. When you're sick, it's time for time out. So let's say you've had an interaction with public health. The way things stand now, everyone who has been notified verbally or in writing by a public health official that they have tested positive for COVID-19, or if they, meaning you, reasonably believe that you have been exposed to COVID-19, here is what the law says you must do. Immediately go to your residence or a location approved by public health for self-isolation. Do not stop at the store for supplies. Do not stop and give Grandma one last hug. Go home. Stay put for 14 days unless public health tells you otherwise. Now, the public health orders give you permission to attend medical appointments if they can't be postponed or held remotely. And you can seek urgent medical help if needed. But if you do leave under any one of these conditions, wear a mask, physically distance, make it quick, and then go home. Go straight home. Go straight home. Go straight home. Now, if you still want to be a bad boy, know that the fines in the form of a ticket are $486 for individuals, including sole proprietorships and partnerships. For corporations that are so inclined, the fines are $2,542. As you likely know, we've had a dramatic increase in cases in southern Manitoba. This has led public health to re-implement travel restrictions to northern Manitoba and remote communities effective Thursday, September 3rd. In addition to these restrictions, all Manitobans are asked to respect any restrictions that First Nation communities have in place. So, to review, the increased incidence of people playing free and easy with the COVID-19 rules of behavior has led Shared Health to issuing special orders for the Prairie Mountain Health Region that have driven things up to Code Orange, a restricted level of the COVID-19 requirements. The restrictions include any time you are out in the public, you must keep your group size to 10 or less. Inside or outside, the maximum number in each gathering on public property of any description can be no more than 10 people. The exception is that this does not include activities that already have measures in place to control exposure to COVID-19. So an impromptu game of softball played in a public park can have no more than 10 participants, but a softball game organized as part of a league can fill the roster on both teams. Spectators must be in groups of 10 or less, and every spectator must practice physical distancing and wear a mask. The second restriction is that the wearing of masks has been made mandatory for everyone in public buildings and for everyone at public events or gatherings. As the great poet T.S. Eliot might have said, the wearing of masks is a difficult matter. It isn't just one of your holiday games. You think at first I'm as mad as a hatter when I tell you masks must cover 3 different things. So my only hope here is that it helps cat lovers remember that their mask must cover their nose, their mouth, and their chin. My apologies. So to wear a mask properly, and with the least amount of difficulty, you must first wash your hands, and then select a clean mask and put it on. It must cover your nose, your mouth, and your chin. If you must adjust it and touch it again, wash your hands before and after each adjustment. Do not share your mask. Do not pull it down so that we can see your nose. Do not let it hang from one ear. Wear your mask so that it covers your nose, your mouth, and your chin. Keep it clean. Wash it after wearing it. Dry it and store it safely for the next time it is intended to cover your nose, your mouth, and your chin. If it's disposable, place it in a garbage bag. So, fundamentally speaking, frequently wash your hands by rubbing and scrubbing for at least 20 seconds. Dry your hands on a clean towel. Keep your hands clean. Keep your hands to yourself. You can't imagine how many times a day people touch their face in a year. Keep your hands in your pockets and you'll keep your face clean. Cover up when you cough or sneeze. Be polite and do it into a tissue or the crook of your arm. If you are sick, do I have to repeat this? Go home and stay home. If you have any one of the 20 COVID-19 symptoms, use the online screening tool at manitoba.ca/COVID-19 to see if you should be tested. When you're sick, behave yourself and leave everyone else alone. Practice physical distancing so you can get good at it. Keep a 2-meter bubble around you and don't let anyone break your bubble. Want to join a group? Before you do, wash your hands and put on a mask. It's the law. Then join the group and count yourself in. If you get to more than 10, it's time to leave. Your gatherings can have no more than 10 people, you included. Wash and disinfect commonly touched surfaces. Keep everything virus-free. Don't share your personal items. It's too risky. Wear a mask or face covering unless you are not medically able to do so. As of September 1st, all visitors to healthcare facilities are required to wear a non-medical mask in order to be permitted onto the site. This extends to outpatients at clinics within hospitals and health centers throughout the province. Manitobans are strongly encouraged to wear non-medical masks when seeking care at any clinic. And finally, in everything we do and say, please be kind. I know you've got it in you. We've seen it before. Think back to 2011 or 2014 when we had the great flood threats. This is a community that got behind those responses. We turned those flood threats into high water events. We worked together. We helped those who had to evacuate. We worked together to build dikes and place pumps. We were thinking about our neighbors. We were kind. Let's take a step back. Take a deep breath, Brandon, Westman, for we are prairie folk. We are kind. Let's be kind to one another. If you're returning from travel outside of Canada, you must quarantine for 14 days. This is a requirement of the federal government. If you're coming to Manitoba from points in Canada east of Terrace Bay, Ontario, use the provincial self-isolation guidelines, which also require 14 days of isolation. Protect your community by using reliable sources of information, www.manitoba.covid/COVID-19. Finally, do not call 911 unless it's an emergency. Please, work with us, do your part, and we will do ours. Thanks, Your Worship.
Thank you very much, Brian. Always a very creative way of putting it across, as you said on a previous broadcast. We're not sure how many times or how many ways we could say some of this, but you do a fabulous job of coming up with the creative way. No doubt that wasn't your own sister you were talking about telling her incessant stories, but I agree with you that this does feel like Groundhog Day. So we are all facing some inconvenience and just having to roll up our sleeves and really bear down on this little virus. Others are more inconvenient and put out than some others. I'm mindful of numerous teams, especially of young people in Brandon and area that whose season had to come to an end. Some were prevented from playing in the championship purely because they were from Brandon, and Brandon has an uptick in cases. It's a factor I find unfair, but such as it is, and my heart goes out to those teams that had to end their year in a fashion not in keeping with what we would all like. And that's in baseball and softball and football and soccer and likely many others. So if you know a young person on a team, just praise out to them. They certainly are owed some extra special attention in a year like this. As for masks, it's been very interesting. I was out and about today a little bit, and I don't think I saw a single individual in any public place, in any store, for example, not wearing their mask. So that was great to see, and it's also very interesting to see the creativity that's going on out there from the people that can sew. Today you can see I'm wearing, sporting a Brandon University Bobcats mask. I understand the Wheat Kings have some on the way, and I've set aside my Blue Bomber mask for the time being to promote some local entities. So, ladies and gentlemen, there's a lot of information out there. It's hard to remember it all, but there's a lot of great links that you can keep up on. You can find them on the City of Brandon website, links to Prairie Mountain Health, to Manitoba Health, to Brandon School Division if you're a little confused on the back to school operations that are about to come up. So it's all out there. Make sure you stay abreast of credible sources of information. So let's carry on. Let's be vigilant at this thing. And as Brian has reminded us once again, let's be kind. We'll be back on Thursday, September the 3rd for another community update. In the meantime, please stay safe and stay abreast of good information. Thank you very much.